Hi friends, let's see the cardinal signs of various disease. In first slide, we are seeing the snowman sign in Cystic. So snowman sign is otherwise known as figure of 8 or dumbbell sign. So in this chest X-ray, the heart is in the shape of snowman. So it indicates total anomalous pulmonary venous rhythm. Next, in CT abdomen, we are seeing a shape of the horse. So it indicates renal fusion, which is abnormal. That means two kidneys fused together and it is forming the shape of the horse. Next is tripod position. So if a child is maintaining a tripod position, then the child is diagnosed to have acute epiglottitis. So you might be thinking about what do you mean by about tripod position? Tripod position means the trunk leaning forward, mouth will be open, and the neck and chin will be extended. So if a child is maintaining tripod position, then the child is diagnosed to have acute epiglottitis. Next is meningitis signs. So we are all familiar about the cardinal signs of meningitis. The first one is knuckle rigidity, Cullen sign, and the last Brudzinski sign. So knuckle rigidity means it is stiffness of neck. So if we are moving or extending the neck, the child or the patient will be facing or the experiencing pain. So the knuckle rigidity means stiffness of the neck. So it's very difficult to move the neck. Next is kerning sign. So in this assessment, we have to keep the patient in the supine position. Then the knees flex to 90 degree. And next, again, we are flexing the hip to 90 degree. So either the patient will be experiencing pain or the patient can't extend the leg. So if it is positive kerning sign, then it indicates meningitis. And the next is Brudzinski sign. Here we have to make the child or the patient in the supine position and we have to do passive flexion of neck. At that time, automatically the hip and knee flexion will be done by the patient. So it indicates meningitis. Next, let's see about the cardinal signs of appendicitis. Appendicitis is a common condition. It is nothing but inflammation of the appendix. So in this condition, McBurney sign is the important one. So McBurney point means the point over the right side of the abdomen, that is 1/3 of the distance from the anterior superior iliac spine to the umbilicus. And McBurney sign refers to the point on the lower right quadrant of the abdomen at which tenderness is maximal in cases of acute appendicitis. So here, if we are palpating the abdomen, in the McBurney's point, the patient will be experiencing pain. So it indicates acute appendicitis. And the next sign is rousing sign. Here, the palpation of the left lower quadrant of a person's abdomen increases the pain felt in the right lower quadrant. Here, in the left side of the lower quadrant, if we are palpating, then the patient might be experiencing pain in the right lower quadrant. So it suggests acute appendicitis. Next, let's move on to the signs of pancreatitis. In this, the first sign is Cullen sign. It is otherwise known as periampical accumulation. So it means superficial edema with bluishing in the subcutaneous fatty tissue around the periumbilical region. It indicates hemorrhagic pancreatitis. Here, just above the pubis area and just below the umbilicus, we can find a bruising. So if we are finding the bruising in the subcutaneous fatty tissue around the periumbilical region, it is suggested to have hemorrhagic pancreatitis. And the next is Gray Turner sign. It indicates severe acute necrotizing pancreatitis. It refers to bruising of the flanks, the part of the body between the last rib and the top of the head. Means in the flank region, if bruising present means it indicates necrotizing pancreatitis. Next is Fox sign. It is a clinical sign in which bruising is seen over the inguinal ligament. It occurs in patients with retroperitoneal bleeding, usually due to acute hemorrhagic pancreatitis. So in the inguinal area, if bruising is present, then it is known as Fox sign. So it also indicates acute hemorrhagic pancreatitis. And the next is Bryant sign. Pancreatic fluid oozing from fistulas at scrotal and right inguinal incision with discoloration of the scrotal epithelium. It indicates Bryant sign. And the next is Crucia sign. The sign is observable as a corpopedal spasm induced by ischemia secondary to the inflation of the sphygmomanometer curve. So here we have to use the BP curve and we have to inflate just 20 mm mercury over their systolic blood pressure for 3 minutes. So a positive sign is characterized by the appearance of a corpopedal spasm which involves flexion of the wrist, thumb and metacarpophalangeal joints along with hyperextension of the interphalangeal joints. This spasm results from the ischemia that is induced by compression through the inflated cuff. So if we are inflating the sphygmomanometer cuff, that means 20 mm Hg over their systolic blood pressure for 3 minutes, then automatically flexion of the wrist, thumb and metacarpophalangeal joints along with hyperextension of the interphalangeal joint occurs. So this positive Crucia sign indicates hypocalcemia. Next is Vostok sign. The twisting of facial muscles in response to tapping over the area of the facial nerve. The increased irritability of the facial nerve manifested by twisting of ipsilateral facial muscles on percussion over the branches of the facial nerve. So here if we are tapping over the facial nerve, due to the irritability, the muscles will become twisted. So this positive sign, that means positive Vostok sign, indicates hypocalcemia. Hope you all enjoyed this session and just summarize one by one again. First is Snowman sign. It indicates total anomalous pulmonary venous return. Horseshoe kidney indicates abnormal renal fusion. Tripod position indicates acute epiglottitis. Nuchal rigidity, kerning sign and Brudzinski sign indicates meningitis. McBurney's sign and rousing sign indicates appendicitis. Cullen sign, Gray Turner sign, Fox sign, Bryant sign indicates pancreatitis. Crucia sign and Vostok sign indicates hypocalcemia. Hope you all enjoyed the session. Thank you.